Hello, Mas Priyo and friends. Today our group are going to present about health and medicine. Before we present the presentation, let us introduce ourselves. My name is Antonio Bagus Rekana.
I am Cedricta Leaterian.
And my name is Adinda Zabrina Putri.
The vaccine acceptance in Indonesia. The level of information known increased as respondents' economic status improves. And people's trust levels in COVID-19 vaccines may vary due to limited information on the type of vaccine, its availability date, and safety profiles. According to reports, vaccine acceptance was highest in Papua, Java, and the Kalimantan Islands, whereas a lower level of acceptance was reported in several provinces in Sumatra, Sulawesi, and Maluku. While all provinces reported the highest level of acceptance, 74%, Aceh had the lowest level of acceptance, which is 46%. The acceptance rate increased with economic status. However, the wealthiest respondents reported the highest refusal rate, around 12%, while the middle class respondents report the lowest. And hesitancy tends to decrease as economic status increased.
Senior citizens in Indonesia will receive the COVID-19 vaccine earlier than expected. The government has approved an inoculation for those over the age of 59. Divyanti Faritz for this report.
All 85-year-old Hilda wants is her dose of the COVID-19 vaccine.
Tak takut nanti kena gitu.
Okay.
Ya, jadi itu kan sehat. Lebih bagus ya.
There was good news for her this past week. Indonesia had at the start planned to focus on vaccinating only those aged between 18 to 59, citing a lack of safety data on the elderly. But there's since been an about turn. On February 8, the health ministry said it will start vaccinating the elderly earlier than planned. With Health Minister Budi Gunadi Sadikin noting that while seniors make up 10% of COVID-19 infections in the country, they account for almost 50% of coronavirus deaths. On February 7, Indonesia's Food and Drug Control Agency approved the use of the Sinovac vaccine for the elderly.
This means 11,600 health workers aged 60 and above will now be the first group of seniors getting the Sinovac jab. But it will be some time still till the rest of Indonesia's elderly population gets their vaccinations.
Some on the ground here still worry that seniors are more likely to suffer adverse reactions from the vaccine.
Menurut saya kalau untuk oma-opanya kan mereka juga udah tua gitu kan, jadi antibodi mereka juga agak kayak yang muda ya gitu loh, malah takutnya karena dia sudah ada penyakit seperti diabetes, darah tinggi atau gagal ginjal gitu, takutnya divaksin malah dia akan kekebalan tubuhnya melemah kayak gitu loh.
The government is planning to tread carefully. The health ministry says seniors who have controlled hypertension and diabetes can be vaccinated. But those with pre-existing conditions, such as coronary and kidney diseases, will not be eligible. Meanwhile, healthcare staff working in homes for the elderly hope they will not be overlooked in the early stages of the country's vaccination drive. While the government has been vaccinating health workers in hospitals, they have yet to reach out to nurses tending specifically to the elderly. Staff here at the Sahabat Baru Elderly Home say they are unsure whether they're in the priority queue for the vaccine. And they say they should be, with COVID-19 fatality rates for the elderly so high.
Kita mohon untuk para perawatnya diberi vaksin supaya mereka sehat gitu, karena merawat orang-orang tua.
It's still early days in Indonesia's vaccination program. The vaccine rollout for health workers is still ongoing and may take a while more. But seniors looking forward to getting their dose of the COVID-19 vaccine no longer have to worry they'll be left out. Devyati Faridz, CNA, Jakarta.
The pros and cons from previous video. For pros, the vaccination of the elderly is earlier than planned. Second, since seniors account for 10% of COVID-19 infections and nearly 50% of COVID deaths, Indonesia's Food and Drug BPOM approved the vaccines are safe. And the first group of seniors to receive the Sinovac will be the health workers age 60 and up. The cons, Indonesia focuses on vaccinating only those aged 18 to 59, citing a lack of safety data on the elderly. Many worry that the vaccines cause side effects and weaken their immune systems. And the elderly home staff is uncertain if they are part of the priority queue for vaccines.
Di update Corona, Saudara Juru Bicara Satgas Penanganan COVID-19 Wiku Adi Sasmito mengatakan, vaksin COVID-19 yang ada di Indonesia efektif melawan varian baru COVID-19. Wiku menegaskan 5 jenis vaksin COVID-19 di Indonesia pada umumnya dikembangkan dengan varian asli yang pertama kali diidentifikasi di Wuhan. Menurutnya masih ada kemungkinan efikasi vaksin menurun saat melawan varian baru corona. Namun tetap efektif melawan varian Delta dan varian lain.
Vaksin yang dikembangkan saat ini pada umumnya menggunakan virus original, sehingga munculnya varian baru berpotensi untuk menurunkan angka efikasi yang telah dikeluarkan. Meski menurun, masyarakat tidak perlu khawatir akan kemampuan vaksin, khususnya terhadap kelima jenis vaksin yang telah digunakan di Indonesia. WHO telah menegaskan bahwa standar vaksin dengan kemampuan membentuk kekebalan yang baik ialah yang memiliki nilai efikasi atau efektivitas di atas 5.
Di update Corona.
So from the previous videos, I analyzed that Wiku emphasized that the 5 types of COVID-19 vaccines in Indonesia were generally developed with the original variant, which was first identified in Wuhan. Also, according to him, there is still a possibility that the vaccine's efficacy will decrease against the new coronavirus, but it is still effective against the Delta variants and other variants. Even though it is declining, people don't need to worry about the ability of vaccines, especially for the 5 types of COVID-19 vaccines that have been used in Indonesia. The World Health Organization, or WHO, has confirmed that standard vaccines with the ability to form good immunity are those that have efficacy or effectiveness in Indonesia, and it is over 50%.
So these are the pros and cons of the previous slides where 25 million citizens of Indonesia haven't received the second dose of vaccination. The pros, first, members of the Ministry of Health continues to educate on the importance of vaccines to Indonesian citizens. Second, the Ministry of Health targets 70% of the population to get complete vaccinations, and the first vaccination has exceeded the target. And the third one, the Ministry of Health is trying to open vaccination centers so vaccination are easy to reach for the citizen. The cons. First, the vaccination schedule set by government might not align with the schedule of the citizen, causing many to build on the vaccination program. Second, when vaccination programs initially began in Indonesia, many of the country's citizens lacked the knowledge about the vaccination and were negatively influenced by the widespread hoaxes, which led many of them to refuse vaccinations. And the last one, due to people assuming that they don't necessarily need it, since they previously received the first dosage. The second vaccine target hasn't met the target number, while the first one has.
For this part, I'm going to explain about the importance of health institution and medicine for society. Medicine is the social institutions that focus on fighting disease and improving health. Health is a state of complete physical, mental, and also social well-being. Society affects health in four ways. The first one is cultural patterns define health. Second one is cultural standards of health change over time. The third one is society's technology affects people's health. And the last one is social inequality affects people's health. Due to the industrialization, healthcare became a responsibility of trained doctors and other specialists. At first, people took care for their own family. The model of scientific medicine is the foundation of the US medical establishment, and this model now has competition of the holistic medicine. This is an approach to healthcare that emphasizes the prevention of illness and takes into account a person's entire physical and social environment. The three foundations of holistic medicine are treat patients as people, encourage responsibility, not independency, and provide personal treatment.
What are the characteristics of vaccine recipients and refusals based on socioeconomic status, religious beliefs, gender, and insurance users? According to the survey, the acceptance rate for male and female respondents was nearly equal. However, 10% of male respondents said they would refuse a vaccine, while less than 5% of female respondents said the same. Furthermore, female respondents appear to be more cautious than male respondents. Approximately 51% of respondents are formal employees, 10% are entrepreneurs, the rest are in other professions, and around 12% are health workers. Muslims were the most common recipients, followed by Christians and Catholics. Participants showed significant concerns about vaccine safety and effectiveness, as well as a lack of trust in the vaccine's haram halal classification. Based on the results of a survey conducted by Health 2020 on respondents' interest in information about the COVID-19 vaccine, 5% of respondents claimed to have private health insurance, and 79% of respondents were covered by BPJS insurance.
A theory known as a structural functionalism views society as a complex system whose components interact to foster cooperation and stability. In Indonesia, society has a big impact on whether or not vaccinations are accepted. The function of society on acceptance of rejections of COVID. On COVID-19 vaccines provided by the government. When a new vaccination is newly widespread, it will have both positive and negative impressions from the society. The manifest function. COVID-19 vaccinations are meant to act as a kind of solution for regaining confidence and establishing social order during the pandemic. People are lining up in droves to get vaccinated in order to relieve of the pandemic and to quickly get back on track or return to a normal situation as before the pandemic happened. The latent function. The spreading of new odd style, which is the vaccine, being injected into their bodies when the society are inadequately educated of its contents, causing hoaxes spreading such as COVID-19 vaccines are haram for the Muslims as the content of it is derived from pig, thus causing major reversal for its citizen as especially the Muslims, as Muslims is the majority in Indonesia. In Indonesia, the public must be fully vaccinated first, second dose, and the booster in order to utilize both public and private facilities and transportation. The manifest function is immunization. Immunizations are given to people so they can function and be included as a member of society. And the latent function is many have a bad opinion of the implementation of vaccination laws and oppose this restriction because they believe it will cost them, especially those who prefer not to get vaccinated or get the second dose nor the booster. They will get inclusion from the society as they can't perform in public or private facilities.
So in the conclusion, the opinion of mass society has a significant role in the acceptance of the COVID-19 vaccine. The government and the Minister of Healthcare are responsible for shaping positive public opinion of COVID-19 vaccine by providing education and information about the COVID vaccine. According to structural functionalism theory, for every positive impact manifest function of COVID-19 vaccination, there will also be a negative impact, which is the latent function. Here are our references, and thank you very much for your attention.